After this video, you're going to know exactly how to manage your knee pain before it gets to the point where surgery is needed. Realistic practical solutions based on where your knee hurts. Is it the front, back, inside, or outside? All explained using simple language. In my last video, we talked about what's causing your knee pain based on the location, where it hurts, what that means, all that good stuff. So if you haven't seen my other video, you should subscribe and don't forget to go back to watch it. I have a lot of great information in there. Now, the question that everyone has is, what do I actually do about the knee pain? Most people know that their knee hurts, but very few understand what actually helps based on the specific problem or the specific location. I'm Dr. Zikky. I'm a board-certified musculoskeletal radiologist. I read a lot of scans. I also perform image-guided procedures to treat various musculoskeletal conditions. That means that I understand the anatomy, how your body functions, and what goes wrong with your knee problems. After reading thousands of knee images in my practice and seeing what actually works for different conditions, I can tell you what the research shows and what I see helping people in real life. I'm not a physical therapist or an exercise expert. Those specialists are really good at what they do, but I'm going to try to walk you through key strategies and a few exercises based on what I see working. No fancy equipment, no surgery for now, just practical stuff that you can actually do. But first, super important, before you start any of these, you have to talk to your doctor or your physical therapist. Everyone's knee is different, and what helps one person might actually make somebody else's knee worse. So get professional guidance first. All right, let's dive in. So if your pain is right in the front of your knee, especially going downstairs or squatting, we talked about how your kneecap probably isn't tracking right within its groove. Your kneecap is like a train on a track. Now, if the track is misaligned or the train keeps jumping up to one side, you get friction and pain. What you need to fix is the alignment. Before we get into what helps, I want to talk about 3 other conditions that cause front knee pain because their treatments are about the same with patellofemoral pain syndrome we just talked about. The first is Patellar Tendinitis. It's also called jumper's knee. This is inflammation of the tendons connecting your kneecap to the shin bone. It's super common in basketball players, volleyball players, runners, anyone who jumps a lot. You'll feel the pain right below your knees. The second is Chondromalacia of the Patella. This is when the cartilage on the underside of your kneecap softens and breaks down. This creates a lot of friction and you get a lot of pain while going downstairs or after sitting with your knees bent for a long time. The third is Quadriceps Tendinitis. It's the same idea as Patellar Tendinitis, just at the top of your kneecap instead of below it. It's inflammation where the quadriceps muscles attach. The good news is that the same 5 strategies also help for these conditions. So whether it's tracking issues, tendinitis, cartilage breakdown, these treatments work. First is quadriceps strengthening. Your quadriceps muscles, which is the big muscles in front of your thigh, they literally pull your kneecap. Now, if they're weak or imbalanced, your kneecap tracks wrong. Like I said earlier, I'm not an exercise expert, so talk to your physical therapy first. But one of the main exercises that will probably have you do is called a straight leg raise. You lie on your back, one leg is bent and the other leg is straight. You tighten the muscle on the top of your straight leg and then lift it about 12 inches off the ground. You hold it for a few seconds and lower it down and do this repeatedly. The purpose is to strengthen your quadriceps muscles without bending your knee too much. So you're not making your kneecap rub and hurt while you're trying to fix the problem. Stronger quadriceps means better kneecap tracking and less stress on those tendons. The second is hip strengthening exercises. This surprises a lot of people, and we talked about this in the first video. Weak hip muscles that make the whole leg collapse inward when you move. That pulls your kneecap to the side of its groove. A physical therapist will have probably a few more exercises for you to work on, but one of the main ones is something called a clamshell. You lie on your side with your knees bent, feet together, and you lift your top knee up like a clamshell opening. The purpose is to strengthen the muscles on the side of your hip that keep your leg well aligned. Now, when those muscles are strong, your knee doesn't cave inward as much, and your kneecap stays in its groove where it belongs. The third is to avoid deep squats or kneeling. If your kneecap hurts, stop doing those things that make the kneecap hurt. Deep squats, kneeling, sitting with your knees bent for hours. All of that compresses your knee into its groove, making the inflammation worse. You're not avoiding these things forever. You're just giving your knee a little break, while you rebuild your strength around the knee. Now, once you're stronger, you can gradually add these movements back in. The fourth is ice after activity. This is simple, but it's effective. After you've been on your feet for a while or done any activity, ice your knee for about 15 to 20 minutes. Not directly in the skin, wrap it around a towel or one of those ice packs for the skin. The purpose is to reduce the inflammation. Your kneecap rubbing creates heat and swelling. Ice really calms that whole thing down. Do it consistently and you'll notice less pain the next day. The fifth is kneecap taping or a brace. Some people get relief from taping their knees or using a brace with a patella stabilizer. Basically something that holds the kneecap in the position while you move or active. It's like training wheels for your kneecap. So while you're still building your strength, The tape or the brace keeps everything aligned so you're not reinforcing that backtracking pattern every time you move. Let's talk about back knee pain or posterior knee pain. If your pain is behind your knees, it's usually tight hamstrings, tight calf muscles pulling back there like an angry rubber band. Or maybe you've got a Baker's cyst. That's a fluid-filled balloon that we talked about in the first video. Let's talk about 4 things that can help. The first is hamstring stretches. You put one foot on a low step or a chair. You keep that leg straight and then lean forward from your hips, not your back. You should feel a pull down the back of your thighs. The purpose is to stretch them and release that tension. The second is calf stretches. Your calf muscles attach around the back of your knees as well. You put your hands on a wall, 1 foot forward, 1 foot back, and you push your back heel into the ground. The purpose is the same idea. Tight calves pull on the back of the knee, aggravating your pain. So loosening them takes the pressure off that whole area. The third is foam rolling. If you have access to a foam roller, rolling out your hamstrings and calf can really help. Be gentle. Don't go crazy on this and overdo it. The purpose is also to break up the tension in the muscle tissues. It's like a massage that releases those tight spots pulling in the back of your knees. If you have a Baker's cyst, remember what we talked about in the first video. This is not dangerous. It's just your knee making extra fluid back there because something is irritating it. The cyst itself doesn't need treatment. You need to fix whatever is causing that irritation in the knee. Usually that's tight muscles or early arthritis. Once you address the main problem, the cyst usually shrinks on its own. I've seen the cyst rupture on their own occasionally, but they'll likely grow again. People would describe a feeling of someone pouring water down their calves. If the Baker's cyst is huge and really uncomfortable, your doctor can drain it with an injection, but it'll probably come back unless you fix the underlying problem. I want to make an important note. If they drain a Baker's cyst with an injection, make sure it's done under ultrasound guidance to first make sure that it's not something bad like an aneurysm or a mass that is sitting back there that can look similar. If it's a mass sitting back there, it probably needs more imaging and appropriate referral to an oncologist. If it's an aneurysm, there's no need to be draining this thing. You need to be referred to a vascular surgeon who's going to treat this appropriately. So they usually put an ultrasound there, put flow on it to make sure that it doesn't have any vascular flow or it doesn't have any heterogeneous appearance that might indicate a mass in the back of your knees. Now let's talk about inside knee pain. Inside knee pain can be tricky because it can be a few different things. Let's break down what helps for each. First is meniscus issues. For meniscus irritation, avoid twisting and pivoting. If your meniscus is irritated or torn, twisting movements can make it worse. You're literally pinching that piece of cartilage. So for a while, try to avoid pivoting sports, twisting while carrying heavy stuff, or any movement that makes that sharp catching pain worse. You're letting the irritation calm down. Meniscus tears don't always need surgery. Many of them will heal on their own and become less symptomatic if you give them time and stop aggravating them. The second is quadriceps and hamstring strengthening. Strengthening the muscles around the knee helps take pressure off the meniscus. Strong muscles around your knee stabilizes your knee so the meniscus doesn't have to do a lot of work. It's like adding a shock absorber to your car. Less impact on those parts inside. All right, for MCL or medial collateral ligament strain, avoid side-to-side movements. Side-to-side movement can stress it even more. So no cutting sports, no lunges to the side, nothing that pushes your knee inward and causes a lot of stress to the MCL. Give it a few weeks of rest. MCL injuries usually heal on their own if you don't keep re-injuring them. The second for MCL injury is gentle range of motion. Once the acute pain is gone, a physical therapist will have you do gentle bending and straightening exercises. You're preventing stiffness. If you completely immobilize your knees, it gets stiff and weak. So gentle movement keeps things mobile while the ligament heals. You can also try bracing for stability. For MCL sprains, now part of my English, if I've said MCL strains in the past, sprains are for ligaments and strains are for muscles and tendons. So when we're talking about a ligament, we're referring to sprain, not strains. So for MCL sprains, a brace with side stabilizers can really help during that healing phase. It prevents the side-to-side wobble that stresses the healing ligament. You're protecting it while it repairs itself. For pes and serine bursitis, we talked about this in the last video, which is that tender spot below the inside of your knees. Some of the things that you can do are ice and rest. This is inflammation where 3 tendons come together. Ice it periodically, avoid stairs or hills for a bit. Let the inflammation calm down. You can also stretch the hip and leg muscles. A physical therapist can show you stretches for your hip flexors, your hamstring, and the adductor muscles. Those are all the muscles that connect to these 3 tendons. If those muscles are tight, the pull on these tendons constantly keeping the inflammation going. So stretching them relieves the tension. All right, let's talk about arthritis with inside knee pain. Some of the things that you can do are low impact exercises. If you've got early or moderate arthritis, the worst thing that you can do is stop moving. Your joint needs movement to stay healthy. So instead of stopping completely, switch to low impact exercises. Swimming, cycling, walking on flat ground. Avoid those high impact stuff, like running, jumping. Movement keeps your joint fluid flowing, which feeds the cartilage. So low impact exercises mean that you are not pounding that joint and making the arthritis worse. Also, weight management is super important, and it's easier said than done, I know. I'm very aware that this is a sensitive topic, but every extra pound you carry puts about 4 pounds of pressure on your knees. So 2 extra pounds of added weight means 8 extra pounds of pressure on your knees. If you're overweight and have knee arthritis, even losing 10 pounds can make a noticeable difference. You're literally reducing the load on an already stressed joint. It's one of the most effective non-surgical interventions for arthritis. Some people find that reducing inflammatory foods like, processed stuff, sugar, excess red meat really helps with arthritis pain. I'm not saying that it's a cure for arthritis, but inflammation in your body makes those joint inflammation worse. Eating more fruits, veggies, fish, omega-3s, all those things can really help. All right, let's talk about outside knee pain. From our last video, we said that this can be iliotibial band syndrome, a lateral meniscus issue, or lateral collateral ligament, or the LCL issue. The iliotibial band, or the IT band, is that thick strip of tissue that runs from the side of your thighs all the way down to your knees. It can rub against the bone, causing a lot of pain and causing what we know as the iliotibial band syndrome. Let's look at 4 things that can help with IT band syndrome. A common exercise is the standing IT band stretch. You cross one leg behind the other and then lean your hip to the side. You're stretching that tight band of tissue so it stops rubbing aggressively against your knees. You can also do a foam rolling for IT band. Now this one hurts. You lie on your side on the foam roller and then roll along the outside of your thighs. It's uncomfortable, but a lot of people swear by it. You're basically breaking up the tightness in that tissue. Think of it like ironing out a wrinkle in a fabric. You can also do hip strengthening. Weak hips make your IT band work over time. So those clamshell exercises that I mentioned earlier, they help as well here. Remember that when your hip muscles are strong, your IT band doesn't have to overcompensate. So less compensation means less tension, means less rubbing, less symptoms from your IT band syndrome. You can also reduce your running volume temporarily. If you're a runner and your IT band is screaming, you need to back off the mileage just for a bit. Cut your runs into half the mileage. Add more rest days or switch to cycling temporarily. I know how you runners get about your running routine, but like I said, this is temporarily. You're just letting the inflammation calm down. Once it's better, you can slowly build back up to your normal mileage, but add the mileage gradually, not all at once. All right, we also talked about knee pain after exercise. If your knee hurts after working out, it's usually one of 4 things. We talked about overuse problems. We talked about weak hips, tight muscles, or kneecap tracking issues. We've covered most of this already, but let me add a few more tips. Warm up properly. Don't jump straight into intense exercise. Spend about 5 to 10 minutes doing light movement first, walking, easy cycling, or whatever. Warming up increases blood flow to those joints and muscles. Cold, soft tissues are more likely to get injured. You can also ice after workouts. Now, try to make this a habit. After any workout that involves your knees, ice it for about 15 to 20 minutes. You're preventing the inflammation from building up. Remember that prevention is way easier than trying to calm the inflammation down once it's raging. Now remember to progress slowly. The too much too soon problem is real. If you're increasing weights, distance, or intensity, do it by no more than 10% increase per week. Your tissues need time to adapt. And if you overload them too fast, they break down, faster than they can repair. Check your form. Bad form during squats, lunges, or running puts extra stress on that knee. Consider working with a trainer or physical therapy to make sure that you're moving correctly. Proper form distributes the load evenly. Bad form overloads certain areas of your knee, leading to worsened pain. A few general tips for all kinds of knee pain. Stay active, but smart. The biggest mistake that people make is completely stopping all activities when their knees hurt. Don't do that. Your knees need movement to stay healthy. Just switch to activities that don't aggravate it as much. If running hurts, try cycling or swimming. If stairs hurt, try walking on flat ground. But remember that movement keeps the blood flowing. It keeps the muscles strong. It prevents stiffness from happening. Complete rest makes things worse long term. Over-the-counter anti-inflammatory medications like ibuprofen, naproxen, they can help during flare-ups. But remember to talk to your doctor first. They're not for everyone. Purpose is to reduce inflammation, which reduces the pain. They're not a long-term solution. You still need to fix the underlying issue. Listen to your body. There's a difference between discomfort and pain. Discomfort during rehab exercises is okay, but sharp pain, that's your body telling you to stop. Don't push through real pain. That's how you turn a minor issue into a major one. Be patient. Knee issues don't fix themselves overnight. It usually takes anywhere from 6 to 12 weeks with consistent efforts to see some real improvement. So stick with it. Do your stretches, do your strengthening exercises, avoid the stuff that makes it worse. I know it's boring, it's not sexy, but it works. Sometimes these conservative non-surgical management is not enough. If you've done all the stuff that we talked about consistently for about 3 to 4 months and you're not getting any better, or you're even getting worse, it might be time to consider other options. This could mean injections or procedures like genicular nerve ablations, or in serious cases, surgery. But most people, like 70 to 80%, get better with all the stuff we just talked about. You should give it a real shot before jumping into more invasive options. So there you have it. Realistic non-surgical management for your knee pain based on where it hurts. Remember, see a physical therapist before starting exercises. Be consistent. Doing this stuff once a week won't cut it. Be patient. The tissues take time to heal. Listen to your body. Discomfort is okay. Pain is not. If this video helped you, don't forget to hit the like button, drop a comment and tell me which of these you're going to try first, what you've tried in the past, what has worked, what hasn't worked, where you are right now with your knee pain journey. And if you want more detailed breakdown on specific conditions, let me know. I'll make dedicated videos on whatever you guys need the most. And don't forget to subscribe and stay tuned for next week. We're going to be talking about carpal tunnel syndrome. Everything you need to know about carpal tunnel syndrome. This is Dr. Zikky helping you take care of your knees and your musculoskeletal health in general. See you in the next one.